Many people believe that natural herbs can boost fertility, but the reality is more complex. Some herbs can actually harm your chances of conceiving. When trying to conceive, it's crucial to understand that some herbs can interfere with hormone production, uterine function, and the conception process itself. Fertility is influenced by multiple interconnected factors, including nutrition, lifestyle, mental wellness, and natural therapies. This is why professional guidance is essential. Always consult with a healthcare provider or qualified herbalist before using any herbs, especially when trying to conceive. Understanding potential risks and exploring safer alternatives is crucial for your fertility journey. This video series will highlight specific herbs to avoid and explain why they may interfere with conception. Remember, when it comes to fertility, informed decisions with professional guidance are always best. Licorice root is a popular herbal remedy, but it poses significant risks to female fertility through its effects on estrogen production. The problematic compound in licorice root is isolicoritiginin, which directly interferes with genes responsible for hormone production. Under normal conditions, estrogen production follows a precise pathway. The hypothalamus signals the pituitary gland, which releases FSH to stimulate follicles, and the aromatase enzyme converts testosterone to estrogen. Licorice root disrupts this normal process in multiple ways. It reduces the expression of genes needed for sex hormone production, impairs follicle growth and development, and significantly decreases the aromatase enzyme. The aromatase enzyme is crucial for converting testosterone into estrogen. Research shows that licorice root can cause a 50% or greater reduction in aromatase activity, which experts consider a serious problem for fertility. Licorice root poses serious risks during pregnancy. It can cause miscarriage and may trigger early delivery. For these reasons, it should be completely avoided when trying to conceive or during pregnancy. Remember, licorice root may seem harmless, but its effects on estrogen production make it a significant threat to female fertility and pregnancy safety. Parsley and cinnamon are common herbs that can significantly affect uterine function. Understanding their stimulant properties is crucial for women trying to conceive. Parsley is more than just a culinary herb. It actively promotes blood circulation and stimulates uterine contractions, making it a powerful emmenagogue. As an emmenagogue, parsley encourages menstruation by increasing blood flow to the pelvic area and uterus. This makes it particularly dangerous during pregnancy. The risk during pregnancy is severe. Emmenagogues like parsley should never be taken during potential pregnancy because they could lead to miscarriage. Cinnamon presents similar concerns. This popular spice has been traditionally used to induce menstruation and can trigger significant uterine activity. Cinnamon's traditional use includes inducing menstruation and regulating menstrual cycles, particularly for women with PCOS. However, this same property makes it risky during pregnancy. To understand how these herbs affect fertility, we need to examine the menstrual cycle and uterine contractions. Both parsley and cinnamon can disrupt this delicate process. Uterine contractions are a normal part of menstruation, but when artificially induced by herbs, they can be dangerous during pregnancy or when trying to conceive. While cinnamon may help regulate menstrual cycles in some cases, it's essential to consult a doctor before taking any cinnamon supplements, especially when trying to conceive. Two herbs require special attention due to their serious risks during pregnancy: sage and pennyroyal. Both can cause significant harm when used improperly. Sage has been used traditionally for reproductive health, but high doses are associated with fetal loss and hormonal disruption. While some believe sage extract can help with reproductive problems, the risks during pregnancy are significant. Pennyroyal is particularly dangerous and is not considered safe for ingestion for any use. This herb is known for causing strong uterine stimulation and has multiple serious health risks. Pennyroyal causes strong uterine stimulation, leading to powerful contractions. These contractions can be dangerous during pregnancy as they may expel the fetus, causing miscarriage. When taken in large quantities, pennyroyal can cause severe liver and nerve damage. The herb is toxic to multiple organ systems, making it extremely dangerous for human consumption. During pregnancy, pennyroyal poses extreme risks to the developing fetus. It can cause fetal death through liver and brain damage, while simultaneously promoting uterine contractions that expel the fetus. Both sage and pennyroyal pose serious risks to fertility and pregnancy. High doses of sage can cause fetal loss and hormonal disruption, while pennyroyal is not safe for any use due to its severe toxicity. Always consult healthcare providers before using any herbs when trying to conceive or during pregnancy. Dong quai is an herb commonly used in traditional Chinese medicine, but it poses significant fertility concerns due to its phytoestrogen content. Phytoestrogens are plant-based compounds that can mimic the effects of estrogen in your body. This means they can bind to estrogen receptors and trigger similar biological responses. This estrogen-like activity can be problematic for hormone-sensitive conditions. Women with conditions like breast cancer, which can worsen when exposed to estrogen, should avoid dong quai. Dong quai can also cause uterine contractions, which significantly increases the risk of miscarriage during pregnancy. The herb stimulates the uterine muscles, potentially leading to premature labor. Despite these risks, dong quai has been traditionally used in Chinese medicine to support uterine health, treat pelvic pain, and address menstrual irregularities. However, the potential dangers outweigh these traditional benefits when trying to conceive. Black cohosh and blue cohosh are two distinct herbs that pose serious risks during pregnancy, particularly through their ability to cause dangerous uterine contractions. Black cohosh, shown on the left, and blue cohosh on the right are completely different plants, though both carry significant reproductive health risks. Both black and blue cohosh can stimulate powerful uterine contractions, which significantly increases the risk of miscarriage during pregnancy. Blue cohosh poses particularly severe risks to infants. High maternal doses have been associated with heart attacks, strokes, and oxygen deprivation symptoms in exposed babies. Traditionally, black cohosh has been used for hormone imbalances, menopause symptoms, and uterine fibroids, while blue cohosh was used to increase blood flow to the uterus. Despite their traditional uses, both black and blue cohosh pose serious risks during pregnancy and should never be used without medical supervision. The potential for uterine contractions and severe infant complications makes these herbs particularly dangerous for expecting mothers. Two herbs require special attention for their specific fertility risks: golden seal and St. John's wort. Each poses distinct dangers through different biological mechanisms. Golden seal contains berberine, a compound that poses serious risks during pregnancy. This active alkaloid can stimulate dangerous uterine contractions. Berberine stimulates uterine contractions that can induce premature labor. The compound also causes jaundice in newborns, making golden seal particularly dangerous during pregnancy. St. John's wort disrupts hormonal balances essential for conception. This herb interferes with the delicate reproductive processes needed for successful fertilization. St. John's wort impairs the sperm's ability to penetrate the egg, reducing conception chances. High concentrations can damage reproductive cells and are mutagenic to sperm, causing genetic damage. Both golden seal and St. John's wort should be completely avoided when trying to conceive or during pregnancy due to their serious reproductive risks. Green tea is widely recognized for its health benefits, but during pregnancy, moderation becomes crucial. Excessive consumption can lead to serious complications for both mother and baby. The first major risk involves the fetal ductus arteriosus, a crucial blood vessel that allows blood to bypass the lungs during fetal development. Excessive green tea consumption in late pregnancy can cause this vessel to constrict prematurely, potentially compromising fetal circulation. The second risk involves folic acid absorption. Green tea is high in catechins, compounds that can interfere with the body's ability to absorb folic acid. This is particularly concerning during pregnancy, as folic acid is crucial for preventing neural tube defects and supporting healthy fetal development. The key takeaway is moderation. While green tea offers health benefits, pregnant women should limit their consumption to avoid these risks. Most medical experts recommend moderate intake rather than complete avoidance, allowing mothers to enjoy the benefits while protecting their developing babies.